trying to look at your baby, babies mostly will be able to look at you. How many of you have felt your baby is trying to look at you, even though briefly? You have felt so?
Yes.
They try to track, you have seen them trying to track a little bit, isn't it? So they have even though they can't see very clearly, their color vision is not clearly developed, they see a background, that's what they see. For example, if your face is fair and the hair is dark, they see that, that white face on that dark background. So that is what they see, and they respond to faces more than toys or any other kind of things. So one of the first things you can use is to use your face and use your sound to stimulate their vision. Okay? So for that, what you have to do is you have to first wrap your baby. And when I talk of wrapping, normally here there is a culture of wrapping the babies with the hands straight. This is not a correct way of wrapping premature babies. When you wrap babies, you need to wrap with the hands close to the chest. Okay? For a term baby, no problem. Whatever way you are wrapping doesn't matter much. But for a premature baby, they have to move the muscles against gravity. They don't have that much strength now. So we are actually helping them to move the muscles against gravity, help them to put hands in their mouth. We have to help them to do these things. So wrap them with the hands close to their chest. Okay? So after nicely wrapping the baby, that is the time when you have to start interacting with your baby. Maybe you can hold the baby up here because they are still small. You can hold the baby up here. Not too close, not too far. 8 to 10 inches is what they can see best. Around roughly, so the 8 to 10 inches roughly comes to this distance. Not very close, not very far. Okay? And then one of the first things you can do by holding your baby is to try to look at your baby, and if the baby is locking at your eyes, you can slowly start moving your face a little bit from side to side and see if they are trying to track you. Don't expect tracking this side and fully tracking to the other side. They never do that. They just do maybe a 30 degree here, a 30 degree there, or some maybe do a 60 degree here, 60 degree there. That's all what they do. They will be seeing the face, yes. They will be smiling. It's not a social smile right now. What they smile is to look at you, identify you and smile. It's around 2 months. 2 months corrected age, I mean. So right now it's just a precursor of, it's just a flicker of the muscles. It is it is not recognizing, and smiling, but you still consider it as a smile, isn't it? Okay, so one of the when you are engaging in vision, the only thing you have to remember is nicely wrap your baby, because if the baby is spread out and no support is there, the baby will not be able to focus and look at you. So give them that support. So I told you, when the babies are relaxed, they try to curl up. So curl them up and then try to engage their vision. Okay?
So when baby is sleeping on his tummy and his hand like that, it's he's not comfortable.
Baby should never sleep on the tummy in the first
No,
place.
when I do kangaroo care, for example.
That's fine. When you're doing kangaroo care and if the baby is thrusting out, it's quite natural reactions which occur. That's fine. Muscles are active, you should be happy about that. And even when you do kangaroo care, they might be trying to lift up their head, isn't it? They may turn the neck side to side. You see a lot of reactions, which are all normal, which is fine. Fine. So this is to engage in vision, okay? And or what you can do is, if you're trying to do this, you can ask the nurse for a footstool, and you sit with the leg on the footstool, so your legs are a little up, and the baby is sort of like this, and then you can look at the baby, whichever way is comfortable for you, depends on the condition of your back. If you're happy sitting like this and interacting with your baby, or you're happy holding the baby like this and trying to look side to side, you can choose whichever way you want.